All right, welcome back, guys, to Bisrat Apologetics. I'm joined here today by Dr. Mlotshwa, and he's a radiologist, and he's going to explain to us today what a radiologist is. A lot of us we hear these terms but don't really know what they mean, and there's lots of distinctions between doctors and so on. So we're very privileged today, and he's going to be sharing with us specifically about breast cancer. It's something that a lot of us are ignorant about. And so it's good for people in the church as well to have better understanding of what cancer is, how it works, and it might not be something that affects you directly, but knowing how it works can help you better pray for the people or care for the people that might be going through something like this. So in this particular episode, we're going to focus on breast cancer, and then in the next episode, we're going to focus on the cancer that affects us as males. Since it was Breast Cancer Awareness Month last month, so we thought let's start with breast cancer. But Dr. Mlotshwa, welcome to Bisrat Apologetics.
Thank you so much for having me.
Sure. And won't you just share a little bit about who you are and specifically what you do? So what is a radiologist? Like, what would you do, on a normal day as a radiologist?
Okay, yeah. So as you said, my name is Dr Mlotshwa. I'm a child of God, and I've been working as a doctor since around 2013, after I graduated from Cape Town. But just a little bit about myself. So I grew up in Pietermaritzburg, then went to study in Cape Town, and then went to Potchefstroom to do my internship, which is where we met. And then after that, did community service and went back to Potchefstroom. But now I'm back home, and I'm working in radiology, which is just one of the many branches of medicine. And I'm now pursuing a career in specializing as a radiologist. And I'm glad that we're actually doing this month in November, because on the 8th of November we were actually celebrating the International Day of Radiology. Yeah, so radiology basically is a medical science that uses various types of medical imaging to diagnose various types of diseases and injuries to help other doctors in terms of planning and treating those various diseases. So radiology, it's sort of described as radiation medicine. So that's where the radio comes from. Radiation, where we use X-rays basically to get certain types of images that look inside the body, because with the naked eye, there's certain things that you can't see. So all these other studies, such as X-rays, ultrasound, CT scans, they help us see inside the body so that we can diagnose all these various types of diseases and injuries, so that we can help doctors like surgeons or cancer doctors, which are called oncologists, to make decisions on how to plan to treat their patients. So in a nutshell, that's what radiology is and what radiologists do.
No, that's awesome. Thank you so much for that background, because we're hearing a lot of ologists or urologists, but some of us never know what these things are all about. But thank you so much for sharing that information. So maybe before we go deep into breast cancer, do you want to just break down to us what is this infection or disease called cancer? For somebody who might not be familiar with it, like, what does it do? Where would you find it in your body, and how do you know you have it?
Okay, so so our bodies are made of trillions of cells. If you remember from like high school when we learned about biology, that our bodies are made up of cells, and inside our cells there's something called DNA, which is basically our genes. Now, these genes, they determine like a lot of things like our skin color, eye color, and even just how our body works. So sometimes what happens is with these genes, they become mutated, um, and then they start creating cells that are abnormal, and then they start growing in an abnormal fashion, and that's what cancer basically is. When the genes are mutate and they start making things that are not normal in our body, and that is what is seen as cancer cells. And cancer also it grows quite rapidly depending on the type of cancer, but it's all the basics is that because the cells are now growing in an abnormal fashion, they become either bigger, and their function as well is completely different to what the normal organ would do. And because we have cells all over our body, you can have cancer of basically anything, be it your skin, your eyes, your stomach, and then what we're going to be speaking about mainly your breast cancer can also occur in that area.
And then, so in breast cancer specifically, it obviously is something that affects a lot of women. But how do you get it? I mean, you explained about the cells and so on. So is it something that is beyond your control, or is it something that you can actually prevent, if you know what I'm saying?
Okay, yes. So if you remember when I was saying that cancer is caused by our genes being abnormal or creating abnormal cells. So sometimes it is a problem with your genes. So it can be inherited. So especially with breast cancer, if a woman has a relative that has had breast cancer before, then the chances of that particular woman getting cancer increase compared to someone who doesn't have a relative that has cancer. But it's not just your genes. There are certain things that you can get exposed to that can then cause you to have breast cancer. For example, actually, even radiation from the some of the machines that we use, like CT scans. If you get too many CT scans done on you, then they can cause some level of mutation in your cells that can then lead to cancer. But there sometimes usually is an underlying problem that would lead you to developing cancer. Yeah, so
No, I
that's
hear you.
basically how people get it. So
No, I
that's
hear you.
basically how people get it usually.
Sure. So I think for a lot of people, maybe, they might be asking the question, how do you avoid this sort of thing? Is it something that is there anything that you can advise and say, we need to maybe do this more so that less of the chances of you getting it, can sort of happen?
So with cancer, usually there isn't really something that you can do to prevent yourself from getting cancer. But the main thing would be that if you have a family history, like someone in your family has had cancer before, just sort of be on the alert. If you develop certain symptoms that you are not sure of,
Okay.
it's best to then just get checked out.
Okay.
Because the main thing with cancer is that the sooner we pick it up, the higher the chances of us being able to treat it, and the lower then the death rate is from cancer.
Okay.
The problem with a lot of people is that you'll have this abnormal cough that just won't go away, and you'll think, no, it will eventually go away. Meanwhile, there might be a cancer in your chest that is growing.
Sure.
And the problem that we face is that when people come to either the hospitals or the clinics, it's a bit too late. The cancer has spread even beyond just that one organ where it started. And then when it's at that stage, then it's the options that we have to be able to treat the cancer are a bit limited. But if we are able to pick it up sooner, then we are able to start treatment much sooner, and that increases your chances of survival as well.
So you mentioned that you can get cancer in your chest, and you can sort of see coughing as one of the symptoms for having it. So how different is that from something like TB? How different are the symptoms?
So sometimes, especially with TB, they can be exactly the same, actually, because it's sometimes just a cough. You lose weight, which is exactly the same as what happens with TB. And then sometimes when you cough up blood, that can still be TB, but it usually when you start coughing up blood, it's because something is eating away at your lung and has now started breaking down your blood vessels within your lung tissue, which is why then blood comes out when you cough. So even sometimes, actually, when we do X-rays, sometimes they actually look pretty much the same. But one of the things that will help us to know whether it's TB or cancer is when we do certain tests, because there are certain things that are called lymph nodes that will grow either on your neck or in your armpits that we can then take to be tested, and that will help us figure out what's actually causing your symptoms.
Okay. No, thanks for that clarity, because it can clearly be something that is blood, so people not knowing which one it could be. But I wanted to ask, in terms of breast cancer, what are the symptoms there? Things that can indicate to you very early that you might need to go see a doctor or get checked up or whatever.
Okay, so with breast cancer, firstly, actually, let me just clarify something, that breast cancer is not just a cancer that affects women. There are some
Okay.
men that actually can develop breast cancer. So if ever you see any abnormality in your breasts, so the main thing that is that what we encourage women to do is to look at their breasts on a regular basis. So if you see there's a difference in size, but this also applies to the men, if there's a difference in size or there are some sort of abnormal changes in the skin where it becomes thicker, or your nipple also retracts and goes into the breast. Those are some of the signs. And then one of the things that we encourage women to do at least once a month, around like just after they've had their periods, is to actually feel their breasts for any abnormal lumps. So one of the things that we do is, if you do this and you feel your elbow, this is what an abnormal lump might feel like in your breast. So you first just feel this to get an idea of what you're looking for, and then you still use these three fingers, mainly these three fingers, and you press around your breast all the way around, just to see if there's anything abnormal, and then also in your armpits as well.
So do you think it's something that's going to be sharp, like as in it's hard, or
so they are usually hard, which is why we use the elbow to sort of get an idea, because usually, especially with women, after they've had their periods, they can sometimes, or actually during their period, they'll sometimes have softish lumps within the breast tissue, but those usually go away a few days after they've had their period. But if you feel something that is as hard as almost as hard as the elbow, and it doesn't go away, then that's usually a danger sign. And then, so if you do pick something up like that, then it's best for you to go to either clinic or your doctor, and then they will either do an ultrasound or refer you to a place where an ultrasound can be done. And then we can then tell whether it looks like cancer or not. And then if it does look like cancer, what we then do is we'll take a piece of it, and then it will be sent off to the lab for us to confirm whether it's cancer or if it's something else. Yeah, but the main thing is to check your breasts regularly for any abnormal lumps, or if there's like an abnormal discharge as well, or sometimes blood may actually come out of the nipple, and that's also a sign. So if you have any of those symptoms, just get yourself checked out, and then the health professional that sees you will then advise whether you need to have an ultrasound done and whether we need to take a biopsy, which is just a small piece of that abnormality that we'll send off to the lab to tell us whether it is a cancer or something else.
Sorry, can you just share a little bit about biopsy? Like, so what is, just maybe a little bit more, expand on that.
Okay, so biopsy is basically just taking a piece of tissue. So it can be either the whole thing. So usually with lymph nodes that are either in your armpits or on your neck, sometimes we are able to take the whole lymph node and send it off to the lab for the doctors that work there to have a look at it. But sometimes if it's something that's too big, especially if it's already like an advanced breast cancer, then it's too big to remove the whole thing just for confirmation's sake. We'll just take a small piece of that that will be sent off to the lab for investigation.
Oh, okay, and who does it? Like, so is this falling under a normal doctor, or who does these biopsy sort of tests and so on?
So biopsies are usually done by surgeons,
Okay.
but all doctors should really be able to do certain types of biopsies, because sometimes you can actually just use a needle. Well, these ones are called fine needle aspirate biopsies. So usually any doctor should be able to do that, but it's usually surgeons or even radiologists. If they see something abnormal when they're doing an ultrasound, then they are able to sometimes take a biopsy at that point in time and send it off.
No, I hear you. And then, in terms of your work and, what you see on a daily basis, how, serious is, I mean, we know cancer is serious and so on, but how many people would you say on a daily basis that you come into contact with, that you do scans and so on, that either, would have breast cancer or some form of cancer? How many, patients would you say a day or a week would you come into contact with that have, this sort of disease?
Okay, so where I work, it's a regional hospital, and I mean we get quite a lot of patients that have all sorts of diseases. So cancers, we do pick them up sometimes, but those are mainly because they're mainly treated in higher centers like tertiary hospitals.
Gotcha.
Most of them will be treated there. But we do see quite a lot of or quite a few cancer cases, especially with breast cancer, because about almost 1 in 8 women are at risk of developing breast cancer. So yeah, so it's there are quite a few that do come across our hospital. But most of them, because they are treated in tertiary centers, they will be found mainly in those type of hospitals. Yeah.
And so I've often heard people talking about, sort of various stages of it when you diagnose it, and they talk about the whole spreading thing, and so on. So maybe just share a little bit about the whole stage thing, and what does it mean if you're in stage 1 or 2 or 4, whatever.
Okay, so that's actually part of our role as radiologists as well, to help with the staging of the cancer, because it depends on how big it is. So with breast cancer, sort of more specifically, it can start in one breast and maybe go to the lymph nodes in the same armpit, which is why we encourage people to check the breast and the armpit.
Mm,
But also, you don't just check one breast; you check both, because it can then
mm,
also spread to the other breast.
mm,
And then with breast cancer, it can also go to it can affect the muscle underneath the breast tissue,
mm,
and maybe even sometimes go into the lungs. So when it
mm,
comes to staging, what what uh, what we do as radiologists, because we can see inside the body um, with CT scans or
mm,
ultrasound,
mm,
we are then able to grade, depending on the type of cancer as well, what stage it is. Yeah.
mm. No, I'm with you. I'm with you. And maybe for some of us who are Christians, right? And I think maybe it's a
Mhm.
specific one for you as a doctor who's a Christian. How do you reconcile these two things? You obviously are trained to help people medically. You use all your sciences, the things that you learned at school. But what role does your faith play in what you do? In other words, how much of your faith are you leaning on in what you're doing, and how much strength do you draw from it? And what role does it play in your profession, if there is a space for it at all? Because a lot of the times, it's always said in a general sense that faith and science are at odds with each other. Now, obviously, me and you know that that's not true.
Yeah.
uh, but however, for someone who's a skeptic, who kind of feels like if you have faith, then you're not going to need medicine. If you have medicine, then you don't need faith. So how do you bring these things together? How would you sort of apply that in your own profession?
Okay, so I mean, the thing that you just mentioned about science and faith being at odds with each other. I think the more I actually look at science, the more I am amazed at just the ingenuity of our God.
Mm,
Um, and so for me, science actually proves the existence of God more than
mm,
disproving it.
mm,
For example, yeah. And then,
mm,
I mean, God is called the great physician.
absolutely,
So I mean, he actually then is our healer ultimately.
absolutely. Mm,
But that doesn't mean to say that if you have a complete faith in God, then you don't need medicine at all, or
medicine, yeah,
you don't
yeah.
need to be seen by doctors.
Mm,
Um,
mm,
because I mean, we are also here for a reason, and
mm,
God can work through us to bring
mm.
healing to our
To people,
patients.
yeah, absolutely.
And I mean, so sometimes miracles do happen where someone is diagnosed with cancer, and then when a scan is done at a later stage, that is completely gone.
Sure,
Um, but also that does not then take away from the fact that some people do require to go through the whole process, because our journeys are all different.
different, yeah, yeah.
Um, uh, yeah, God can heal someone through a miracle that can't be explained by anyone,
Mm,
but also
mm,
God uses the medical field to heal patients in a sort of more
mm,
gradual um,
mm,
uh, way that will still lead to them being healthy.
mm. No, thanks for that. That's actually a very good way of saying it. And I think also, what I think about is, if you look at the hospital, I mean, it's a very tense place. And I think a lot of people come there with hopelessness. And
Mm,
you sort of are inclined to believe in God, when you're going there. I mean, I've sensed it when I've gone to the hospital, even if I'm visiting a patient, but like prayer is always something that kind of is in the background. You're thinking about, yes, you're trusting that the doctors are going to do what they're doing, but ultimately you do recognize that it's not in your hands. It's ultimately, beyond your control. And then you seek something that is, beyond yourself. But when you look at your patients and that sort of thing, do you kind of get a general feeling that people are inclined to turn towards God when they are there? Or do people sort of blame God, for being there? Like, what would you be your observation of patients? You see different people every day. You're at the hospital, and
mm.
is it moving away from prayer and from God, or do you feel like people are kind of are looking and seeking God? I mean, I've heard a lot of stories of people who've been saved at a hospital after they obviously received a miracle of some sort. But just wanted to hear from your side if there's anything that you observe that kind of points towards God in the hospital.
So I mean, depending on what the patient has come to the hospital for, or what disease they have, there will be a sort of level of hopelessness, or even anger towards God. But what with some patients that I have visited in the wards and have prayed with, a lot of people do then find hope, or encouragement even when someone comes along and offers prayer. And as you've said, you've heard of stories of people who have actually even been converted, or have accepted God into their lives after they've been in hospital, and not necessarily after they've sort of received some sort of miracle, but just by someone coming across and sitting with them, talking to them, and praying with them. They feel that that person was sent by God, and they then sometimes they will then accept him into their lives as well. Yeah, that's what I've seen.
What is the current state of the hospital in terms of allowing, ministers and church people to come in, and how much faith is allowed to be practiced in the hospital? Like, I know back in the days, people would have these morning prayers and all those things. Are those things still allowed in the hospital?
Yeah, no. Even where I work, every single morning, and actually every single shift change. It's mainly the nurses though that practice this. They will start off their shift with a prayer, be it the morning shift or the evening shift, and they will sing praise songs before they start work. So that is still something that happens. And then when it then comes to allowing people to come into hospitals, so it's usually just during visiting hours, where you would still need to speak to the sister in charge when you walk into the ward, and just ask them if there are any patients that would be willing to be ministered to. And I think it's something that would still be much appreciated by those patients, especially if they are patients that believe in God. And sometimes even if it's patients that don't, if they are willing to listen to someone coming to minister to them, that could help to make their stay a little bit better. Because to be honest, being in hospital, whether be it in a private or public hospital, and being away from your family, it does sort of make you feel what's the word? But you don't feel good being in that sort of
alone and so on. Yeah.
And if anyone comes through to bring prayer or some sort of encouragement, I think it's something that would be much appreciated by anyone in any facility, be it a hospital, a clinic, private or public. And I think it's something that should still be encouraged everywhere. And it's just that I haven't heard of any people doing hospital visits of late, but I think it's something that is still being done.
There's still a need for it.
Yeah, and there is still a need for it. Yes.
I have a lot of questions, and I think it would have been nice if we sat down during COVID, because it would have been nice to just hear from somebody who's a medical professional who was working. And I know I'm drifting a little bit, but I'm going to come back to the cancer. But I just think that there's so many questions that kind of pop up as we talk about the hospital. How was it during COVID? We saw a lot of doctors praying and all those things, but for you personally, how was that experience of knowing I'm going to work, there's danger that's there, a lot of people are dying in the hospital, so it's quite a tense, difficult place, more intense than it is now. But how was your experience, during COVID and that sort of time period?
So for me, I think one of the things is how favored by God, I felt, or just how I felt like I was somewhat protected from it, because just from me personally, had I gotten COVID, the chances of me actually dying from it were higher than the average person.
Yeah.
Mainly because one of the risk factors is being overweight,
Sure, sure.
which is something that that I still face.
Mm,
Um, and I'm just thankful to God that not even once did I get diagnosed with COVID.
mm,
But I was still actually in the front line for quite a long time
oh, mm,
once the pandemic had started. Because
mm,
the whole of that of 2020, I was still working in the pediatric department, where we see kids coming in from home, coming in with their parents.
mm,
And yes, there were measures to sort of check whether people did have it or did not.
mm.
And we did have protective equipment, but quite a lot of my colleagues were still actually getting COVID.
Yeah, yeah.
Some of them had to be even hospitalized. Um,
Mm,
but I do thank God that He shielded me
mm,
from that.
mm, mm.
And I mean, also just people were actually even getting it from family members.
Yeah.
And
See, so not even from the hospital.
not even, yeah, just from the hospital. It was people that you live with that may have gotten into contact with someone who had it.
Mm,
But it was a difficult time. Um, because I mean the protective equipment that we were wearing, um, it can be very hot if you're wearing all of that, especially
mm,
in the weather that
yeah.
we have here in South
Yeah, it's
Africa.
very
So it
hot.
does make it a little bit more difficult to work. But also just the number of patients that we were seeing that were dying as well. It was because there was a bit of an increase in the number of deaths as well around that
Mm,
time. Uh,
mm,
Especially when it, like in the beginning stages of it.
mm,
So it did make it difficult
mm.
to continue loving your profession when you were losing so many people.
Yeah, so many people. Yeah, it was quite a tough time. But yeah, thanks
Yeah,
for sharing, because we always, sort of, for us, it was just stay at home and that's it. But for you, it
yeah,
didn't just mean you couldn't just stay at home. You had more stuff to do.
exactly,
You had to kind of help other people while still trying to protect your family, protect yourself. So
exactly.
I understand it would have been more complicated for you guys at the hospital. Yeah, and
Yeah,
then just in conclusion, is maybe coming back to the breast cancer is how do we care
yeah,
for people who, obviously who've been diagnosed, who have a lot of fear, who are very worried about the future and all those sort of things?
yeah.
How do you support them? What do you need to know, and all those things?
Okay, so just with cancer, I think in the past, especially in the past, there was a lot of stigma around it. And I
Mm,
think that was mainly because people didn't really understand what cancer was, and a lot of people used to think that breast cancer is a death sentence,
mm,
which is not the case. Especially if we're able to pick it up much sooner,
yeah.
breast cancer can be cured. I think it was just a couple of weeks ago. We did a CT scan on a lady who had been treated for breast cancer. I mean,
Mm,
unfortunately, they had taken the breast completely off, and then we were just doing another CT scan to check whether the cancer has come back or not. And
mm,
unfortunately, it hadn't. There was no evidence of cancer.
mm,
But she did survive, because I think she had the cancer removed in June, and then we were just doing a checkup now,
mm.
and she can still live a full life,
Wow.
because now the cancer has been removed.
Mm, that's awesome.
So cancer is not a death sentence. If you
Mm,
know someone with cancer, it doesn't mean that it's not. So cancer is not contagious in the way that the flu is, for example.
mm.
If
So
you
you don't have to
go to church
run
with
away from
someone,
them.
yeah. So there shouldn't be any stigma around cancer.
Mm,
Um, and it's just so just how to support them. Um, is to just encourage them and pray for them, and whatever needs they have, if you are able to attend to those, to assist with those. Because sometimes, especially once you start getting treated, maybe even with chemotherapy, it may even be difficult to eat, especially actually to take care of yourself, preparing meals for yourself. So if there are people with cancer going through treatment, if you guys can assist with preparing meals for them, helping clean their homes, that kind of stuff. I think it just to have some sort of support structure around them would be, I think, very beneficial for them.
Absolutely.
Yeah.
Thank you so much for that. And I think, for those of us who are Christians, we're very grateful to have people like you, in the field. And for us, it's really about waving the kingdom flag in these places. And when we see you guys doing the work that you're doing, you're still representing God. And in a sense, it's God still working within the profession. And so, yeah, we're very grateful for you, and also just for the insights that you've shared with us, and also just reminding us how we can care for people, how we can know about cancer and all these sort of things that do affect us as people. And so we're going to try and get you back maybe for another interview, maybe getting into prostate cancer. That's another one that affects a lot of people. And I think it helps us as people to have a better understanding of these things. And God works, in the medical field using medicine. He's the one that gives us the brains. He gives us, the mind to be able to comprehend how mathematics and physics and all the laws that God has set in place in order for us to be able to help people. And so we should actually praise God for these sort of things, because really people discover, how these things work. It's not necessarily that we invent these things. And so, Dr. Mlotshwa is at Herry Gwala Regional Hospital at Pietermaritzburg. He's somebody who loves the Lord, and so we're truly grateful for coming to share with us today. Thank you so much.
All right, thank you so much for having me. And then just one last thing, just the take-home message for everyone: to please not ignore any changes in your body that you don't understand. If there's something that you are unsure of, just go to your nearest health facility, be it a clinic or your GP, and then they will direct you accordingly where you should go. But yeah, thank you so much once again for having me. Looking forward to seeing you again.
Yes, thank you. We'll see you guys in the next video. Thanks. Cheers.
All right. Thanks. Bye.
Thanks, man.